Good afternoon, everyone. My name is Ian Colbert. I'm the Executive Director of the Canadian Public Health Association. I'd like to welcome you today. Today's webinar on public health research in an academic setting, which is part of CPHA's webinar series on a career in public health, shaping your future. This webinar is being recorded and will be available afterwards for download. The Canadian Public Health Association is the commercial aspect of today's webinar. CPHA is the largest, oldest, and most established independent public health organization in Canada. We currently have over 1,200 members, approximately half of which are students and trainees. So we certainly want to hear what your needs are and how we can meet them. We've heard that you are interested in a career in public health. You're looking for mentorship and networking opportunities with other public health professionals, and you may be seeking additional sources of funding through student awards and bursaries. So we're in the process of developing programs that can help meet those needs. The webinar series is one of those opportunities that we've been offering since September 2016. The series is geared for students and early career professionals and take place monthly from 12 to 1. So there's a variety of topics, as you can see, and they are free for CPHA members and cost $12 for non-members. So we're going to do a little mini poll and just to see where people are tuning in from across the country. So just click away to indicate where you're enjoying the webinar from. Okay, big turnout from Alberta. No surprise there. Super. And then we will do a second poll. Just curious to see if you're a member of either the Canadian Public Health Association or the Public Health Physicians of Canada. Perfect. Thanks very much. So, just a little bit of background on how the webinar works. So all of the participants are muted, but you can update your status throughout the webinar using the options displayed. You can give some hints if you need someone to speak louder or more slowly. There are little buttons for you to use for that. We ask that you please post your questions and comments in the chat box visible to all participants. If we can't answer your question during the webinar, we will follow up by email. As I mentioned before, the webinar is being recorded and the recording will be made available to all CPHA members and registered webinar participants shortly following today's webinar. We will make the slides and recording more broadly available 3 months after the webinar. At the end of today's webinar, you will be redirected to a short survey. Please take a moment to send us your feedback. At the end of the webinar, I'm also going to be mentioning some opportunities for student involvement at CPHA that you might be interested in, so stay tuned. It's now my pleasure to introduce today's presenter. Elaine Hyshka is an assistant professor at the University of Alberta School of Public Health and scientific director of the Royal Alexandra Hospital's Inner City Health and Wellness Program. Her applied health services and policy research focuses on advancing a public health approach to substance use and is conducted in partnership with several local, provincial, and national policymakers, healthcare providers, and public health advocacy organizations. So welcome, Elaine, and the microphone is all yours.
Hi, so everyone can hear me okay? I'll take that as a yes. Okay, great. So thank you very much for attending this webinar today. It's really nice to see how many people have logged in. And I think the topic, public health research in an academic setting, was a bit challenging for me just because it is so broad and there are so many different facets of doing this. And depending where you're at, the advice can be a little bit different. So before we get started, I'll just go through what I plan to speak on today. If I can advance my slide. There we go. And then I'm going to do a few polls just to get a better sense of who's in the audience so that I can tailor my comments and some of what I discuss accordingly. So After we go through the poll, I'll just briefly review who I am and what my current position is, and what research I do. And then I think I'll focus a little bit more time on discussing my career trajectory, which I'm hoping will have some value because I know personally when I was a student, I would often see people that were in careers that I wanted or were similar to the type of career I wanted, and I really wanted to know how they got there and what they did. And so hopefully we can demystify some of that a little bit. And then I was asked to discuss some of the highs and lows of academic research, and there are a lot of those. And we'll finish off by just discussing why someone might want to pursue an academic career, and if you plan to do that, sort of what are your options and what should you do to be successful. Oh, Emma, I'm not sure. Oh, yeah. Oh, great. So here's the poll. So the first poll, I'll just ask you to indicate your current level of education, just so I can have a better sense of where everyone's at. Okay, so it looks like most either have a bachelor's degree and maybe are contemplating graduate school, or have a non-thesis master's, which is likely an MPH. And then we see we have a few with PhDs and some with thesis-based degrees. Perfect. So we'll just switch to the next poll. And so now I'm just asking you to think hypothetically, or for some of you, maybe this has already been decided, but what pillar of research would you see yourself working in? And so these are the CIHR pillars. And so there's four. The first is basic science or biomedical research. The second is clinical research, typically around like clinical trials and improving tests or treatments. Health services research, which is what I do, or socio-cultural, environmental, or population health research, which I also do. All right, so it looks like almost everyone is in pillar 3 or 4, which is great because I think my experience is most applicable to those pillars. All right, and so just a brief note about the results before we move forward. The reason I wanted to know why individuals or what pillars people might place themselves under is just because the path to an academic career can be quite different if you're in basic science or clinical research. And so I'll just say that as a disclaimer that what I'm going to talk about today and the tips I have are based on my experience pursuing a career in pillar 3 and pillar 4. Okay, so I won't go over this, but as Ian mentioned, I'm an applied health services and policy researcher, and most of my work is related to substance use. So my current positions, I have two. I'm employed through the University of Alberta. They pay my paychecks. And I hold a primary faculty appointment as assistant professor in the School of Public Health. And I'm in the health policy and management stream, and I'm in a tenure track position. My appointment started in April 2016, so note that I am myself a novice academic researcher. And so I think that has pros for this webinar because I was certainly in the position of looking for a tenure track position for the last couple of years. And so that's very fresh still, and I can certainly relate to graduate students. But the cons are obviously that I've had less experience in academic hiring, for example, or hiring committees, and less experience sort of observing that process as a professor. So beyond my faculty position at the U of A, I'm the scientific director of the Inner City Health and Wellness Program at the Royal Ox Hospital. And so what that means is that I actually have my research program located at the hospital. So my main office is here. My trainees have offices here or space here. And my day-to-day activities are mostly spent here. The Inner City Health and Wellness Program is a sort of unique program. It was established by a Royal Alexandra Hospital Foundation grant in 2014, and the grant funded a clinical and education and research arm. I lead the research arm, and the whole program is led by Dr. Catherine Dong, who is an emergency medicine physician and clinician scientist. We conduct applied research in partnership with affiliated clinicians, senior hospital leaders, and community partners. And beyond sort of the day-to-day of the research, I also tend to be engaged quite a bit in sort of committees and different meetings at the hospital around themes related to substance use and inner city health. And this appointment started at the same time as my faculty appointment last year. So, and I'll just clarify that because have this affiliation with the hospital, I currently spend about 75% of my time on research and only 20% of my time on teaching and 5% on university service. So that's not always typical. A lot of new professors, when they start their positions, will be 40-40-20. So 40% teaching, 40% research, and 20% service. And that at our university, at least, is sort of a standard allotment. Although typically this is negotiable with your dean, and it depends a lot on some of your specific circumstances. My main projects that I focus on are currently the Canadian Harm Reduction Policy Project. So that's a CIHR funded study where we're looking at how each province and territory approaches harm reduction policy making and the extent to which they have formal policies in this area. We're evaluating those policies, and we're also conducting qualitative interviews with key informants from across the country. We're doing a media analysis in every jurisdiction to look at how the media covers harm reduction. And we're also doing public opinion surveys to see how public opinion may vary across different Canadian jurisdictions. Other projects include an evaluation of the Addiction Recovery and Community Health team. The ARCH team is the clinical arm of the Inner City Health and Wellness Program, and it's a novel service model that has not been studied before in Canada, and there's few examples of anything similar in North America. So we're evaluating how effective it is for meeting the needs of patients who are socially marginalized and experiencing problematic substance use. Beyond that, I've also been working on some new grants that I just got this last year that are examining the political and policy aspects as well as the legal aspects and practical aspects of providing harm reduction services in acute care. So the Royal Alex is one of only a few Canadian hospitals that provide sterile injection supplies, take-home naloxone kits, safer injecting education, safer crack use supplies, and other harm reduction materials at the inpatient bedside. And there's very little documented on this in the literature, and so we've been doing some interviewing with staff and patients to see how this is going and to better understand what makes for solid implementation in this area and what is the impact on the hospital and on patients. And then finally, I've been heavily involved over the last 5 years, but it's really ramped up in the past year with the Access to Medically Supervised Injection Services in Edmonton initiative. And this is a coalition of 25 community organizations, some government people, and some academics. And we have been doing a lot of work to try and secure supervised injection services in Edmonton for people who use drugs. And I'll just say too, if you have any questions as I go through my slides, please don't hesitate to post them and I'll try and address them as I see them. So now that you know a little bit about the types of work I do and myself and my position, I'll just review how I got here and sort of what I did. And the bumpy, windy road is intentional. So I started my training actually technically at Center High. I had to upgrade when I finished high school because I barely graduated, which is another story. But once I was able to get into university, I did a Bachelor of Arts in Sociology. And it's cheesy, but it's true. The way that the webinar was advertised is that I really did have sort of a pivotal moment when I took a course in third year undergrad where I got an opportunity to write a paper on Canadian drug policy. And I learned a lot in that course about the political nature of policymaking and how, in my opinion, a lot of what we do around policy and how we try to address substance use is not based on evidence at all and can be, in many cases, causing more harm than good. And so I was really compelled to study that area more and just to better understand how we can achieve more evidence-based approaches to substance use in Canada and internationally. So after that course in third year, I decided that I wanted to try and get into grad school to do a master's in the area. And so I deliberately spent my fourth year trying to get as much research experience as I could in preparation for applications. And so in the fall term, I registered for courses that would give me volunteer research placements and just to try and beef up my CV a bit and make myself more competitive. I was lucky and I got accepted into the University of Toronto's sociology program. And then prior to moving to Toronto in 2007, I worked for a summer as a social science researcher at the Canadian Forestry Service for Natural Resources Canada. And that was really my first sort of research job. Once I was in Toronto, I did a course-based master's, but instead of doing courses over the summer, I did a research elective, and so I basically did a mini master's thesis as part of that. And my supervisor was Patricia Erickson, and my area of study was on cannabis policy. And while I was there, I also held TA and RA positions. After completing my degree, I moved back to Edmonton, and I spent 2 years working as a research coordinator in the Faculty of Extension. And I worked for, it was a neat position because I was working with two organizations, and my job was to essentially help physicians and clinicians who wanted to conduct research, learn more about qualitative methodology as well as community engaged research, or how to engage with community partners. And so I spent 2 years sort of acting as a research consultant and helping to write grants and helping to do implement projects and do analysis. And that gave me a really a breadth of experience in sort of health research and helped me understand more of the health funding landscape. But by sort of a year or just over a year into my position, I really did enjoy this position. I had an excellent, oh, here we go. Did your lack of scientific background ever, sorry, there's a question from the audience. So, did your lack of scientific background ever offer barriers to understanding physician and other stakeholder views on addiction? So, by scientific background, I'm assuming you mean medical or psychiatric training. And yes, so we'll get some clarity. Yes, okay. No, because most people who practice in this area understand that there are very strong psychological, sociological, and environmental factors that shape substance using behavior, even in the context of substance use disorders and dependence. And so I typically have not encountered a lot of barriers in that regard because I am an expert on the environmental, the sociological, and some of the psychological aspects of substance use. And so my perspective tends to complement more biomedical understandings of addiction. But I would say I have in the past experienced some pushback because my main research methods tend to be qualitative or policy research. I do some quantitative. I've done some epidemiological research, but that doesn't tend to be the focus of my program. And so that can be a challenge when you're working in a health sciences environment and when you're competing against basic scientists and clinical researchers for very limited grant funding. You really need to know how to position yourself and how to sell your research in a way that a biomedical person who's used to reading basic science papers will understand and appreciate. Anyways, so getting back to the slides, in kind of winter 2000, so end of 2009, start of 2010, I had sort of determined that I wanted to pursue my PhD. I was very passionate about the area of substance use and understanding it more, and addictions more generally. And as much as I really liked my position and I had an excellent mentor in the Faculty of Extension, who's named Maria Mayan, who's a qualitative methodologist, I really wanted to be able to pursue my own interests again. And so that's kind of how I knew I wanted to do a PhD, is because I wasn't sort of happy being a generalist that worked on a number of different areas of research or a number of different content areas. I really wanted to focus on what I was passionate about. And so that's why I decided to pursue a PhD in public health sciences. I had the option of going back to do a PhD in sociology, but my 2 years experience as the research coordinator at the U of A had taught me that, unfortunately, maybe for especially for social scientists, there tends to be a lot more money invested in health research in Canada, and so it seems to be that there's just more funding opportunities to apply for, and so you have better odds of funding your program. And because I was already sort of bridging health when I was studying substance use and drug policy, it was a natural fit to go into public health sciences, especially because public health has done an excellent job of incorporating social science perspectives. And so it was a really good home for me, and I think it was a really important decision that I made, and I'm very grateful that I had a strong supervisor in public health sciences to do my PhD with. So I specialize in health promotion and socio-behavioral sciences, and I divided up my doctoral training into pre-candidacy and post-candidacy because I think depending on what stage you're at in your PhD, you're going to want to pursue different opportunities. During the pre-candidacy period, while you're completing your coursework, I think it's important to try and maximize the breadth of your training as much as you can. And so I was able to secure a Western Regional Training Center in Health Services and Policy Research Fellowship. And that fellowship was really pivotal because it gave me the opportunity to do a research practicum or placement. And it gave me the sort of rationale I needed to cold call Thomas Kerr, who is an internationally renowned researcher and a mentor of mine, who was at the BC Center for Excellence in HIV/AIDS. And I basically just emailed him and said that I had this opportunity to do a placement, and I sent him my CV, and I wrote, I believe, a letter explaining why I was interested in working with them. And we had a phone call, and in the end, I ended up going out to Vancouver for the summer in 2011, and I was working with their research group, the Urban Health Research Initiative, studying different aspects of harm reduction and injection drug use. I also began, when I came back from Vancouver, I started volunteering with the Medically Supervised Rejection Services group in Edmonton. And during this period, I also held a number of different RA and TA positions. I completed my candidacy in 2013 and started working on my thesis research. That was a bit, figuring out what I was going to write my thesis on was a bit complicated because my advisor did not have sort of a grant that I could just piggyback my PhD off. And if you come out of social sciences, or if you're working with someone who's more social science oriented, that's very common. In medical sciences or biomedical sciences, typically you kind of carve off a piece of a supervisor's project, and so it's already funded. But that's not common in social sciences, at least in my experience. And so I kind of had to find funding and figure out how I was going to do the work I wanted to do, and so that took a bit of time. During that period, I took a short stint working at the City of Edmonton Office of the Councillors in a part-time position, just to help someone I knew who had just been elected to council set up their office and help him make some early decisions around municipal policy. And I also, towards the end of my degree, I think it was in 2014, I started working at the Inner City Health and Wellness Program, where I am now. But at the time, I was an evaluation consultant. And so I was working part-time with them to help them set up the evaluation of the ARCH team in the very early days of the program. I also was a co-instructor for a course, The Social Determinants of Health. And during that period, I wrote and completed my dissertation, which was called Assessing Consumer Perspectives on Population Need for Substance Use Services. And it actually involved an epidemiological study and a massive scoping review. So a lot of what I started in my PhD actually kind of naturally dovetailed into what I'm doing now. And I'm still working on a few of those projects that were originally funded while I was still a student. And I've started to add additional funding or additional projects. I guess I'll just go through a bit of what I do. And it is true, I know it sounds cliche, but I have a lot of meetings, like a lot of meetings. You meet with students, you meet with people. There's always different initiatives going on in your faculty or your department that you're typically, as a new professor, asked to contribute to because you're bringing a new perspective. I spend a lot of time currently engaging in media interviews, as well as engaging political stakeholders, just because of my work with the Access to Medically Supervised Injection Services group. I conducted the research that demonstrated the need for supervised injection services in Edmonton, and so I often am asked still to speak on that evidence to a variety of different audiences, and I have met with dozens of different stakeholders in that regard. I teach. I'm teaching Intro to Health Policy Management. Currently, because of my split, I only co-teach one MPH course. Most new professors will usually in faculties of public health will teach a bit more. I work closely with a number of different community agencies and partners, and so I have a lot of meetings with them, including Canadian Drug Policy Coalition, which has been convening a national level group looking at how to implement supervised rejection services across the country. I put that track changes document up because I spent a lot of time reviewing work of other people, including scholarship applications or manuscripts that have been drafted by my students. And I'll just give a shout out to one who's I see on the call here, Heather Morris, who has been or who I've spent lots of time reviewing her scholarship applications, which is great, and also just writing different reports and manuscripts for different audiences. So it's hard to say sort of like how much I spend on each time every day, and it definitely varies. I find the nature of academic research is it ebbs and flows, and you're doing different things at different times, and I like that. I find that very exciting. It keeps things interesting. Some weeks you'll be focusing on trying to get a manuscript out. Other weeks you'll be inundated with media requests or a whole bunch of stakeholder meetings around the issues you're working on. And my experience isn't universal. Obviously, not all academics do as much sort of around the engaged scholarship piece or trying to contribute to policy change in their research areas, and that's totally fair. That's certainly not necessarily a requirement of everyone, but that's what I've chosen to do, and so that does keep me quite busy. So instead of talking about highs and lows of academic research, I thought I'd talk about the pros and cons. And I think these are important to consider because I have seen a lot of people that have started out pursuing an academic career and then really thought twice about it and probably made the right decision to pursue a different path, in part because of some of the cons they encountered. So the pros of an academic career, from my perspective, are 100% that you can almost always pursue your own interests. You can focus on what you find very interesting and what you're passionate about, and to me, that is the biggest plus. I personally don't think I would do well in an environment where I would have to be working on a whole bunch of different content areas and have sort of a more broad area of expertise and less opportunity to study things in depth. Like, I know that I'm very interested in my field, and so I'm very fortunate to have a career that I can continue to study that or contribute to policy change in that area. It's exciting to me to be able to contribute to knowledge and to publish, and to know that that's incrementally. Sometimes people would say it has very small impact, but it's you're codifying things and you're putting them out there, and it has your name on it, and that's exciting. Additionally, I appreciate the flexibility. I have to work very long hours, but I tend to be in fair amount of control over my own schedule, which I do like. Being an academic or a professor, it does give you credibility in a platform, and you can use that platform to try and advocate for evidence-based policy. I really like the mentoring side of academic research, and I'm certainly a novice mentor, and I'm learning a lot about mentoring as I'm starting to supervise my first students. And I do enjoy the work environment. It's one of the few careers where you can surround yourself with like-minded people that are interested in the same things you're interested in, and that you can have really interesting conversations with them every day. There are a number of cons, though, and I won't sugarcoat them. Being a new professor, especially on the tenure track, is very, very long hours, and you are faced with a lot of competing demands, and sometimes it can be hard to juggle those demands, quite frankly, and it certainly can lead to some sleepless nights and a lot of stress. So I think you need to sort of be very dedicated to what you want to do and what you want to study to endure that, because it is very demanding, and it can be overwhelming if you have trouble kind of finding outlets for it. Oh, there's a question here. Also, there's lots of uncertainty. Uncertainty and rejection are really a part of life as an academic. And I know there are some academics that are very, very successful and have, millions of dollars of research grants, and they've made important names for themselves, and that's amazing. But even they would likely tell you that they often get rejected. And that's just part of it. You're always putting yourself out there, whether it be, as you finish your PhD, applying for jobs. I know I applied for a lot of jobs, which I never heard back on at all. And, it takes a lot of time and effort to put those applications together. So it can be a bit demoralizing. Um, Grants are challenging sometimes. You put a grant in and you think it's really good and you get it back and the reviewers just hated it. That can be, a blow to the ego as well as sort of make you question your approach. However, I will say that there is often a lot of learning opportunities when you get rejected, as well as publications. I was at a conference a few months ago and I was listening to someone who I see as one of my main sort of role models in academia talk about how she had a paper rejected 6 times. And that made me feel a lot better that, it doesn't just happen to us on the bottom, it happens to people that are very accomplished scholars. By lots of demands are you referring to, the question here is, by lots of demands are you referring to the amount and type of work or the effort that goes into maintaining good stakeholder relationships? I would say both. When I say lots of demands, I'll say, for example, just this week, I'm being pulled in the direction of there's a committee that's trying to formulate new curriculum for our faculty, and I really want to be part of that, and they've asked me to be part of it, but all of my I'm traveling during most of the meetings, and so I feel guilty about that. I have 2 manuscripts that are due at the end of this month that I've been trying to write and get out. I'm helping students with scholarship applications currently. Also, I had to prepare this webinar as another demand just this week. This afternoon, I was supposed to present to the police commission on supervised rejection services in Edmonton, and that just got canceled last minute, but that's another demand. And so it's essentially you get a lot of requests on your time from a lot of different people, and you also have pressure on yourself to get your manuscripts published, to get your research projects going, to check in with your students, and to do all these things. And it can be really challenging sometimes to balance all the different demands. And it's not a bad thing, it's the nature of work, but it is something that I would highlight as one potential area of stress and a potential con. I have a question here about, can you shed some light on going into a career in implementation science in the public health field? If you want to work on researching primary care practitioners, is having a clinical background necessary to have, like an MD? Because I've heard in order to do research in primary care, pure researchers may not be considered credible. Well, I'm honestly not a clinician, and so I can't speak from the perspective of a clinician and what they would say in terms of who's credible. I do research in the hospital. I also do research on harm reduction services delivered by RNs and peer outreach workers in the community. And I certainly am not a harm reduction worker or an RN, and I'm not an addiction medicine physician or an infectious disease doctor. So I think sometimes you might find challenges that you are less credible, and when I do interviews with my colleague who is a physician and we talk about the need for harm reduction to address the opioid epidemic, he often, is the doctor and I'm the researcher, which is fine. So that I'd say it's possibly a risk, but it can be mitigated if you do high quality science and if you engage with the right partners. So I work closely at the hospital with physicians, and so they help inform my research and help interpret my findings, or inform the interpretation of them, so I can fully understand the context. But because I also employ rigorous methodology and publish in peer-reviewed journals, I think a lot of that does get it does get I'm able to buy credibility that way. But it's true, there's always a challenge when you're studying, practice of someone that is not you, or you're not trained in that area. And it's just important to be really cognizant of that and to look for strategies to mitigate possible concerns about your credibility. All right, and then the last 2 things I'll mention in terms of cons are, it's really hard to find work-life balance as a new professor, and I think a lot of people will tell you that. There is a lot of pressure on you to publish, to get grants, and to generally meet all the demands of your time. And so, it tend to be easy to kind of forget about yourself and to not exercise or not find, some time off to decompress. And I'm still struggling with that. And I'm trying to find a way to contribute or to commit to more work-life balance. But if that's something that's important to you, an academic career could be very challenging. And then finally, it's really important to mention that when you're doing a PhD and if you're pursuing a tenure track position, your mobility is, you have to be mobile. And I ended up at this institution that I did my PhD in, but that is very rare. And most people have to move. And I was anticipating having to move. And so you need to sort of be flexible and be willing to move for new opportunities if need be, if you do want to pursue an academic career, just because the tenure track positions are so few and far between these days that often there's not going to be something available in the next few years in your area. Okay, so there's a question here about being a non-thesis MPH grad pursuing a PhD. Can you offer any advice on following the PhD path without prior thesis experience? I think I'll get into a bit of that in the next few slides, but I would say that it's important to publish and get as much early research experience as you can while you're doing your PhD. And that's because if you didn't do a thesis-based master's, you likely have less or no academic publications. And when you go out on the job market, if you want a career in academic research, even if you're not pursuing a tenure track position, having publications really strengthens your application. And so I'll get into how you might do that in the next couple of slides. But I would say that that's my biggest advice is you need to kind of make up for the opportunity that you might have missed in your MPH, where you probably actually got a lot of other interesting and good experience from your practicum and other activities. But that would be the one deficit that you may have that you would want to focus on addressing as soon as you can and not wait to do your thesis and get your thesis papers out. Because often when you go on the job market, you're a year away from finishing your dissertation. And so you may actually only have one paper published out of it or none. All right. So if you decide that academic research is for you, what are your options? I've talked a lot about being a faculty or a faculty member or professor, but you could also be a research associate, affiliate, or scientist. And I'm seeing these positions becoming increasingly common in my field in Canada. I know a lot of people and colleagues who have done PhDs and now are professional researchers and their positions tend to be soft funded, but often for multiple years. And so they get to basically work full time in research, often in the research that's directly related to their thesis. And they don't teach and they don't do any of the other kind of activities related to being a professor, like service. So if you really like research and you have absolutely no interest in teaching, this might be a position for you. The downsides are that typically you're employed off grants. You may contribute to writing those grants, but whoever the principal investigator is often has a final say in what the grant is about. So you have a bit less intellectual freedom that way. And also, obviously, even if you're really good, oftentimes your position is not permanent. It's based on on grants, and so there is some uncertainty in terms of ensuring that there's always enough grants to keep your salary funded. I put those two careers in blue because they typically require PhDs, but not always. Especially sometimes I've seen research associates with master's degrees. Additionally, you could pursue a career as a research professional. I know a lot of people who are full-time employed with good benefits in university jobs, and they work as research coordinators or research assistants or statisticians, or they are sort of doing more project coordination and administration roles of research. Sometimes people end up working for funders that fund research, and oftentimes too, you may be a clinician like an RN and find a position where you're working as a clinical trials nurse, for example. So your full-time job is working in research, but you're still using your clinical expertise. Other types of careers include a clinician scientist. If you're trained in a health sciences discipline and you pursue a PhD or you pursue a master's degree, Often you can get a faculty appointment that is a blend of clinical and research experience. And one of my closest collaborators, Janetta Salvalaggio, is a very strong academic family physician who has a clinical practice, but also spends 30% of her time on research. And increasingly, there are consultant positions where you are employing yourself, but you respond to requests for proposals, or you know, form partnerships with academic researchers, and you kind of cleave off a piece of their work and you complete that on your own terms. Most consultants that I encounter who work in research are not working in academic settings or on academic projects, but they're doing similar types of work for government or for nonprofit groups. So if you're thinking about doing a PhD, I just want to throw a slide in here to kind of explain the process that I went through and some of the learnings I have on this. A PhD is long. The average time to completion in Canada is around 7 years. I completed mine in 5.5, and that was well under the university's average completion. So it does take a long time, and you should be prepared for that. Increasingly, in the context of the academic job market, because faculty positions are not as common as they used to be, PhD students are feeling pressure, rightly, to get experiences during their degrees that will contribute to their marketability outside of academia once they complete their degree. And that's certainly what I did, working as evaluation consultant for Inner City Health or with the City of Edmonton. Those were deliberate choices I made to try and increase my skill set outside of an academic context, or at least with one foot in the health system, to try and ensure that when I completed, if I couldn't get a position as a professor, I would have other options, either working in government or in the health system. And this is raising a whole bunch of questions. Did I take evaluation courses as part of your PhD? Yes, I did. I took a really good course on program evaluation, which I supplemented with my previous knowledge of qualitative and quantitative methods. Let's see if there's a few more questions. Don't you need to do postdoc work after the PhD before becoming a prof? That's a really good question. I didn't. If you look at Canadian statistics for people applying in social science positions, actually you're more marketable as soon as you finish your PhD than after a postdoc. And so that comes as a surprise to some people, because depending on your discipline, some people will say, no, you absolutely have to postdoc. And I was definitely told that too by different people. I will say that I have definitely seen people get positions without postdocs. And so it's never too early to try. And if you're going to be looking for a good postdoc, and if you have some good publications under your belt as a PhD student and you've been able to get some external funding, I don't see any harm in starting to apply for positions early while you're trying to line up a postdoc position. Are there steps you can take to reduce the time that the PhD takes to complete? The only steps you can take are to basically focus solely on your research. Find a supervisor that has external funding that's dedicated to your project, and that you can start your research right away. Start your research before you do your candidacy exam, with the anticipation that your candidacy proposal will be based on the research you're collecting. Those are some strategies you can use to finish earlier, but the trade-off is that you'll have less opportunities as a trainee to engage in other professional development activities, which could be crucial for getting a job moving forward. So there's some questions about whether the work I was doing ever impeded my PhD timeline. I've heard that having external positions can sometimes impede on scholarship funding opportunities because of the added income. That's true. Depending on who your funders are, if you have scholarships, they often will have requirements that you only work a certain amount of hours in a different job, and that most of your time is spent on your own PhD studies. And I had those constraints, and I navigated those. So it is something to be aware of. You can't always take paid positions or if you are taking them, you can only work a certain amount of hours per year in those positions. And so if you do have scholarships right now, it's important to read the guidelines of your scholarships because they'll tell you how much you can work. I personally didn't find that it impeded my progress because I find, and I think some people who've done PhDs that are on the call might agree, that when you are working on your thesis and you have sort of your entire day is unstructured and it's supposed to be focused on getting your thesis completed, it can be challenging to stay focused and stay sort of on task and on time. And so for me, having a small commitment to another position at times during my degree actually helped me focus more the time that I had when I did have time to spend it on my PhD. I was very productive because I wanted to make sure that I was continuing to get progress. But that's something that I would suggest talking to your supervisor about if you do hold scholarships, because there are rules around employment, and so you do have to be careful to not impede those rules. And I was able to navigate that, but it is challenging. Additionally, some other considerations are your career goals. If you're thinking if you're thinking about doing a PhD and you really want to be a professor, then it's that makes sense. But if your goal is to work in government or to work as a health system leader or as an administrator, you can probably achieve a lot of those positions with a master's level training. A PhD does help make you more competitive for some jobs, but in other cases, it can be seen as a liability because you're seen as overqualified for the position you want. So thinking a lot about where you'd like to be when you finish is important because PhD is an opportunity, but it can also be a constraint in some cases. Additionally, as I mentioned before, I knew I wanted to do a PhD because I really wanted to specialize. Not everyone has that sort of drive to focus very narrowly on one area, and you may be someone that really wants to learn a lot about a wide variety of topics. So you might get tired of your topic after a while, and so that's something to consider. You need a passion for research. The PhD is grueling. It's often unstructured. You often have you're on your own a lot, and you need to be able to keep yourself moving forward. And so if you don't have a strong passion for the work you're doing, that can be challenging. You, as I said, are often autonomous, even with work, depending on your supervisor. Some supervisors are very rigid and want to see regular check-ins and put a lot of sort of constraints on your activities. My supervisor was the opposite. He was very open. I could go weeks without talking to him at some points, just depending on the stage I was at and what I was working on. And so you need to be able to sort of set your own deadlines and goals and enforce them on yourself to make sure you're making progress. You need perseverance. This comic is, I think everyone that's done a PhD at some point can relate to this comic. There certainly was a period during my training where I was asking, what am I doing? And is this going to end in a job I want? And am I ever going to graduate? Those are not uncommon feelings. They're very, very common. And so just being aware that they can happen, even if you feel like you're super interested and super dedicated to your work, as I am. You have to deal with a lot of uncertainty as a PhD student. It is scary when you're working very hard on your thesis, but you're not sure what the outcome's going to be. That can wear on you, and it can be challenging to think, maybe I should have stayed in the workforce, and maybe I should have kept a job and not have pursued this PhD. And so just be aware of that. You also need to see how flexible you are and your family is. If you have children or if you have a spouse, they may be less mobile, and so that's a consideration. And the other consideration is a lot of times there isn't funding available, and scholarships are increasingly competitive. And so you need to kind of reflect on your financial situation and decide whether you're willing to do your PhD unfunded, and if you are, what the trade-off is. Like, how much would you make in the workforce for the 5 or 6 years that you're doing your PhD full time? So if you consider all those things and you still are interested in pursuing a PhD, which I think is a good idea, I think a lot of people are, I'm not trying to discourage anyone. I'm just trying to sort of be realistic about some of the things that all PhDs in Canada and the US are facing. Some tips for success on an academic path. Try and understand as early as you can what it takes to be successful. I mentioned a few things like publications, external funding looks really good when you're applying for positions. the sooner you know what you need to do, the sooner you can start working towards those goals. Always have a non-academic plan B, in my opinion. This is just good planning, just because in some disciplines, only about 8% of people who graduate with PhDs will get an academic position in their field. So try and get skills either on a volunteer basis or as an employee somewhere, or even consider breaking up your training so that you have some additional stuff on your resume. So if you are applying for jobs outside academia, you're competitive. And take advantage of your trainee status. Don't be afraid to cold call people. If, for example, I mentioned when I went out to BC, I didn't know anyone there. I just kind of sent emails and helped, and hoped for the best. That was the same for my master's and PhD supervisors. I didn't know them at all. No one introduced us. I just had to kind of send an email and try to convince them to take me on. But people want to help trainees. And if you're a student, a graduate student, people do appreciate, mentoring and doing and supporting your development. And so it's very rare that you'll be in a position in your career where you can just say, by the nature of your status, you want help from someone or you want to learn from someone. And oftentimes that works out. So I'd say don't be afraid to see what you can do as a student and what your freedoms are to get additional training. And then always pursue external funding. Especially if you're hoping to get an academic position as a faculty member, having a track record of external funding in terms of scholarships is really beneficial. Sometimes your supervisor will give you a stipend, and that's great, but still go for external funding because it looks prestigious on your CV and it can help assure people who are reviewing your application that you are competitive in a broad field, nationally or provincially or wherever. I tried to use my coursework as much as possible to lead to publication. So if I wrote a paper for an assignment while I was doing courses as a PhD student, I often would approach the professor and say, I'm thinking about trying to turn this into a publication. Is it okay if I write the paper this way so that I can then submit it to a journal? And I always, most professors are very supportive of that. And I tried very hard not to write anything of length in my PhD studies that I didn't then submit for a publication. And so that might just be a literature review or a commentary, but those things do matter. And especially as an early career person, those types of publications can be really important for boosting up your CV. And then I'll get to some of the questions, but the last thing I'd say is try and be kind. When you're in a graduate student environment, oftentimes there's a pressure to compete against your colleagues, either for internal funding or, you're both applying to the same scholarships or you're applying to different opportunities. In my experience, you don't have to be super competitive and, kind of cutthroat to get ahead. In fact, in many cases I can think of, I had colleagues that we would share our scholarship applications with each other or we would share different opportunities with each other. And then it kind of worked out for both of us. And so grad school is hard and it's very grueling and there's a lot of uncertainty, especially at the PhD level. And so if you can be kind to your colleagues in general, that's going to help you build up a network of people that support you and that you can go to when you're stressed out. And it's also potentially going to lead to additional opportunities that wouldn't have been there if you were sort of more closed off and seeing everyone as your competitor. So I'll just address some of the questions here. We have a little bit of time left. So Jeff's asking, how do you address the topic of publication with your supervisor? It is an expectation that your supervisor will always consider the opportunities for publication for you, or is it? Or do you need to bring it up? And if so, how do you have that conversation? That's a really good question. Typically, as a supervisor, when your students are applying for scholarships, or if you're trying to get summer studentships or whatever funded, you have to have trainees that are publishing on your CV. And that goes the same for sort of the teaching components and mentorship components of your faculty reviews. You always have to highlight how you've been supporting your trainees to potentially publish. But that also depends on your discipline. In health sciences, we have papers with 10 or 12 authors. That's not weird at all. But in social sciences, often their papers are single author or just 2 authors. And so navigating that can be a bit different depending on your discipline. If you are interested in publishing something and you have an idea for a publication, I encourage you to bring it up with your supervisor. Generally how I approach things and what's been my experience as a trainee is that if you're the first off, if you write the draft and it doesn't get changed significantly by someone else, then typically you remain first author. But your lab may have a publishing arrangement that, or your research group may have sort of an MOU related to publications that you should investigate. As well, your department often will have a policy about when students should be on papers and when is appropriate to take them off papers. So these are all things that you might want to investigate at your departmental level. But if you're interested in publishing and you have an idea of turning one of your papers that you wrote for a course or working on one of your projects into a publication, I encourage you to discuss it frankly with your supervisor and to express that desire and ask them what they think about it, and if it's reasonable, and if so, how you should move forward. Leslie is asking, on the note of an academic plan B, can you speak to how a PhD in an area of public health could enhance job opportunities in non-academic areas? For example, if you know of people who have completed a PhD in an area of public health research that have then accepted non-academic positions, what have they been? Very good question. I actually have a colleague who works for the College of Physicians and Surgeons of Alberta as a full-time researcher who just finished her PhD. And so she does research with them on a variety of issues related to primary health care. And she has a PhD in public health and a nursing background. Lots of people end up working for government, especially if you have epidemiology training. A lot of government epidemiologists have PhD training in public health. What else? You may end up working in a policy position, so you may not be conducting research, but if you can write well and you know how to evaluate evidence, that can be very valuable for working as a policy analyst in the Ministry of Health or working, at the municipal level in public health. So there's a lot of different positions, and sometimes you have to think creatively, but I would encourage you, I've seen in the last 5 years, there's been a lot more discussion online in sort of academic websites, but also non-academic websites and on Twitter about how to pursue an alt-ac career, and that's ALTAC. And alt-ac just means having a PhD essentially, but working outside of academia. And so one that I like to, so I would just encourage you to check out different websites related to that, because they often have much better tips than I do in terms of how you, for example, convert a CV to a resume, or how you sell your PhD experience as work experience that is valuable for the potential employer. I should add that I'm keenly interested in public health qualitative research and find that hard to integrate into my current job. Yes, qualitative research modalities tend to be less common, although I will say the colleague I mentioned who's working full-time for the college, that's her expertise. So they are less common, but they do exist. Any advice for recent undergraduates looking for research experience before grad school? I'm not sure if research-based or practice-based is the way to go. Are there research opportunities for students who only hold undergraduate degrees? Yes, there are. I've had students volunteer with me in the past, or with my supervisor, who were considering whether they wanted to go the research route, and they approached one of us and then asked if they could volunteer in our group. And so that's always a possibility. I field a lot of those inquiries. If you are trying to sort of just get your feet wet and volunteer, I think that, and you're comfortable volunteering, I think that that's one route. Although I will say, to make it more realistic, or to increase your chances of being accepted into a group, I would clearly outline in your email why you have an interest in that research area and what skills you would bring as a volunteer. And that can help you get your foot in the door. And oftentimes having someone who's working for you unpaid then turns into a paid position, because you've worked with them, you see that they're contributing and that they're bringing something that's valuable, and then you hire them as a research assistant.
Great. Well, thank you very much, Elaine.
All right. So if there are additional questions, you feel free to email me.
Well. So hopefully everyone who's been listening in got something really valuable out of today's session.
I think, I really appreciated the questions that were asked. I think they're all really good questions, and certainly things that I had to sort out on my own, or, during my training. So thank you very much for your contributions today.
Applications are due.
I guess I'll leave it to Emma to kind of wrap it up.
And so that's for the spring session. We also have a number of new leadership positions available with our Student and Early Career Committee. If you're interested in marketing communications, the Student Ambassador Program, or being an early career professional lead, please email us, and the applications are due by February 10th. So that's just around the corner, can you believe it or not? So the final note we wanted to mention was Public Health 2017, CPHA's annual conference, is being held in Halifax, Nova Scotia this coming June 6th to 8th. And there's going to be a number of student and early career professional events that are being planned, including a mentor lunch, some breakfast sessions. And if you have submitted an abstract through the call for submissions, you could be eligible for the John Hastings CPHA Student Award, which is $1,000. But if you haven't submitted an abstract, sorry, that closed before the holidays. So CPHA is very active in a number of different areas, including the areas that relate to Elaine's research. Just before the holidays, we issued a position statement on the opioid crisis in Canada. I invite you to check out our website to take a look at that paper and all of our recent policy and advocacy work. So I think that's everything for today. If you have any questions or concerns, don't hesitate to reach out to us. Thank you very much. And registration is now open for the March webinar, so check that out on our website. And we hope to see you then. Everyone have a great day. Thank you. Bye-bye.